good to be with y'all and get to hang out. We're just going to kind of talk about pop health, clinical stuff, and let kind of all of our people know what it is that y'all do on a day-to-day basis. We've known what you've done for quite a while now, but it's kind of new, improved, and growing all the time. And you're obviously one of the newer members of the team, working with Jeff Wood's team and all the great work that you do. So maybe let's start with introductions. Katie, ladies first, if you just kind of want to talk about your background, how long you've been at Hig, and kind of what your day-to-day has looked like up to this point.
Sure. So Katie Callender, Director of the Population Health Management Team here at Higginbotham, going on 14 years, so December will be my 14th anniversary. My background is in nutrition and exercise science, and then I got my master's in public health, so pretty well-rounded from a well-being perspective. But currently managing a team of 9, which is the biggest our team has ever been. Very exciting to have a larger team on board to help our clients, and just kind of working on the day-to-day aspects of client population health efforts, whatever that means to them, is what we're going to help them with.
Yep, and great. And prospect meetings.
Yeah, a lot of special projects.
The Higginbotham platform, but now we've got more partners to help there. So, yeah, just a wealth of knowledge. Dr. Ritter, if you want to kind of introduce yourself to the conversation, your background, all that kind of stuff.
Sure, I'd be happy to. And I can't help but think in this kind of setting of office space, where there's the two Bobs on the other side of the table, and they're like, what is it that you do here?
Yeah.
I'm a people person. Sorry. No. So my background is as an emergency physician, and so I've come to Higginbotham with that clinical background and still maintain that clinical practice. And as the conversations that we've had in the past, I didn't want to leave that, because I feel like it's such a big part of what I do, and it helps keep me grounded and integrated into what's happening clinically and at the point of care with patients and physicians. But joining Higginbotham has been wonderful, because it's given me an opportunity to figure out how to bring that background and marry it to a desire to improve systems, or to make healthcare work better, or to align incentives so that we can help get people to the right care faster and for a cost that's more reasonable. And I've been able to do that, right from the get-go, and it's been inspiring, and at the same time, aligned with sort of the vision that I had for making positive change.
Love that. I think maybe a good place to kind of kick things off, Katie, would be, let's talk, like, as he kind of talks about a little bit of where we're going. I would love for you to kind of set the stage of maybe like the history of population health management at Higginbotham, leading up to present state, and then I'll kind of guide our conversation towards where we're going, and we'll just kind of all collectively talk about what that looks like.
Sure. So I think the team actually started probably about 20 years ago. So probably an early leader in the field, but it's evolved quite a bit over those 20 years. I think originally when you talked about population health, it was probably coined wellness, not necessarily population health. And that might have been a little bit of a soft connotation for our clients. People might have assumed that meant on-site yoga or, anything of that nature, where we really were trying to target high-cost claimants, those chronic diseases that plagued our clients' claims experiences. And over time, I think that that's shifted a little bit. We see evolution within the industry, so we see evolution within our team too. We've kind of had some back and forth with the experience levels of folks on our team, or the backgrounds. We've had a nurse at one point. We've had dietitians. We've kind of run with whatever we had at the time, but I think we've really tried to intentionally build the team over the last couple of years, not to chase trends, but just to try and evolve with the industry and get ahead of things that might be happening for our clients. So, 20 years ago, there was a handful of us in the industry, but now it's a pretty saturated market. Everybody in pop health and DFW knows everybody in pop health. So we've kind of picked and pulled the resources that we could, but with the team now, we've got expertise in dietetics, we've got a mental health specialist, we've got a sports conditioning coach, we've got people in public health, we've got folks in data analytics, we've kind of got it all. So I think over time, we've really tried to, again, be intentional about that growth. Again, not chase trends, just kind of make sure that we're evolving with that and that we're staying ahead of the market so that we can be pretty proactive with our clients.
Yeah, it's I think you're really spot on that. I mean, I remember when I first started at Hig, which was 10 years ago, I remember how, talking about wellness was kind of a uniqueness for us. It wasn't getting talked about that much by our competitors. Now it feels kind of like table stakes that you have to be at least discussing pop health, in part because we're seeing a migration towards self-funding, which I'll kind of double click on in a second. But because now that's table stakes, then the question becomes, how good are you? Mm-hmm. And what is it that we're doing all the time to be super effective, which I drank all the Kool-Aid, and I believe we're the best at it because of you and the work that your team has done. But to talk about kind of what I'm seeing on our book of business is you see this migration of we used to be a primarily fully insured shop. Mm-hmm. We're becoming more and more self-funded, which the benefit there is data. And as we see that data, then it's allowed us to obviously react and for your team to be just that much more effective. Dr. Ritter, when I talk about data, one of the things that I remember from the first times we ever kind of interviewed and talked about, you kind of envisioned this world where there was a dashboard that clients would be able to look at and hopefully all of us collectively respond to what we see. Maybe talk a little bit about that vision and where we are now and how that is working on behalf of our clients.
I think that's a deep conversation that you could expound upon for a very long time. But at its core is the idea that we want to help companies, clients be good stewards of the resources that they're dedicating toward employee benefits and that they're dedicating toward taking care of their members. I think part of that mission that really inspires me is that you're better aligning incentives. And I think clients are eager to be able to make sure that their employees, who are their extended family, are healthy. And so I think what's really unique and I think that we do better than anyone else is finding out how to do that in an evidence-based way. And I kind of draw this paradigm or analogy from taking care of patients. And when you take care of a patient, you have to understand who the patient is, where they're coming from, where their understanding is of what's going on with them. And then you, as the communicator, have to be able to process all this information in a way that's digestible and then have that information lead to either a behavior change or an outcome or an intervention. And I think I envision how we partner with clients in a similar way, that we create this relationship through bedside manner, camaraderie, trust, culture. And so we're then able to take, let's say, all their claims data from the previous years, which would be the analogy of getting a bunch of blood work and tests, and then have the ability to process that in a way that's digestible, information forward, and helps guide interventions. And that's, I think, what is going to set Higginbotham apart, and what's going to set our ability to take care of clients apart is then being able to bridge that data that we have access to with tried and true solutions that have worked across the book of business within Higginbotham, so that we can respond in real time, not retrospectively but prospectively, so that we can help bend the curve of healthcare expenditures while keeping people healthy. And I think that is a system that works a lot better than maybe it has worked traditionally.
Yeah. Both of y'all can talk about this. I mean, I remember we've had this conversation around patient care. You and I have talked about this in terms of implementation of interventions is only as effective as a person is willing to adopt. So oftentimes we're communicating on aggregate to the lowest level understanding, or even for you talked about in single patient instance is I can prescribe whatever medicine, but if they're not going to adhere to it, then it doesn't matter. The greatest intervention in the world is only as good as the implementation that's associated with it. So maybe both of y'all kind of talk about the challenge that exists there.
Yeah, I would say we've come across that challenge in every single client across every single industry, right? An individual doesn't necessarily just make a change because their employer tells them to, right? It doesn't mean that they start shifting towards the behaviors that are upstream of chronic disease, right? It doesn't mean that they're paying attention to their diet or that they're moving intentionally or that they're, accessing preventive care. So our job has historically been to help employers understand the value and the benefit of those behaviors, but incentivize the employees to do it in a way that makes sense for those specific employees. So that could be very different based on the demographic makeup of the client, the industry of the client. But ultimately, everybody needs to engage in preventive care utilization, right? They need to go get their teeth cleaned. They need to get their annual physicals, which hopefully means that we catch things before they become catastrophic, before they become a little bit more unmanageable. But we are also in tandem trying to teach those employees at the macro level, kind of in aggregate, what you can be doing to address your nutrition, your physical activity, your ergonomic setup, your mental health, all of these things that contribute to the downstream effects. So from our goal, we're always trying to incentivize and not only let employers know kind of best practice what we see, but keep them compliant as well. There's a big regulatory environment around workplace wellness and what you're encouraging your employees to do. And does that include spouses? Are we looking at the catastrophic claims to know what we should be incentivizing? So we're really trying to direct clients in the right direction.
Right.
I think everything you said. And I think the biggest takeaway from that is compliance. And I think that there's a bit of an art to inspiring compliance and engagement and buy-in. And I bring too many medical analogies, but it's the only analogies I have, so forgive me for doing that. But, you can be the smartest clinician in the world, but if you're not understanding who your patient or client is, then you're not going to really inspire compliance. And I think what I've noticed in my own practice and here at Higginbotham is giving the client all the information that they need to understand how their choices are going to drive change. And I think that lack of transparency that has been there historically has bred a feeling of futility. And so not most of the time, but sometimes there's a feeling that you can't really engage and change your behavior to have an impact. And it's like losing weight. You're going to have to make a lot of change and embed a lot of new behaviors, and you're not going to really understand if it's working if you're not tracking some sort of data. Do you have a scale that you can measure? And I think that's where we're going to set ourselves apart, is being able to help prove to the clients or patients in this analogy that what they're doing is impactful, and then giving them evidence that it is, and then helping walk with them along this journey continuously as partners to help keep proving to them that what they're doing is making an impact. And I think, I think that that's the future that we're moving toward, where we're able to equip with information so that whatever it is that they're doing to help mitigate, over claims exposure is actually working.
One of my favorite analogies that you always say about like inspiring change and adherence and all those things is like, we can either give them a carrot or a stick or an orange stick. Mm-hmm. Like those are kind of our options. Yeah. I'm always like, that's spot on.
Yeah. I don't know if I've coined orange stick or not, but that's just kind of what makes sense to me.
Yeah.
But I think the same ethos kind of applies in Dr. Ritter's analogy. A patient, a doctor needs to understand the patient. We as a broker need to understand the client, and that might mean understanding the cultures that exist within that employee population. That may mean understanding the nuance of the industry. If somebody from our team walked in and wanted to put a strategy in place that focused on, mammograms, and the average employee was a 50-year-old male, like that doesn't make a lot of sense, right? We have to understand what's going on with that employee population, and access to the data is just going to give us more of that so that we can further narrow our strategy.
Right. Gosh, and there's so much nuance, like with clients. I try to explain this, to people that aren't in our industry is, we can introduce the best intervention in the world, but benefits are a cultural thing. Like benefits involve emotive decision. They're usually not purely financial. If everything was purely financial, disruption didn't matter, you could change a lot. But, every CEO, CFO, HR director that I meet with, they're wearing both hats of like bottom line, but also how will this be received by my people? Can I recruit, attract, retain people here? And that is like there's so much nuance there.
I would add to that. I think that they're also sitting in the seat of imagining themselves being users of these benefits.
Yeah, that's fair.
So, they're putting themselves in the shoes of, well, how would I react since I'm going to be insured in this plan as well?
We get to live that here at Hig every day because we also help administer and select the benefits here at Higginbotham, and I've always kind of used that as one of our success stories. You've been the captain of that ship from the beginning. Maybe just give some high level like history of like what Higginbotham's history has looked like there.
Yeah, we've had our internal wellness program for a really long time. I would say, 2007, I think, was the kind of inaugural year. And it's certainly grown since then. Back then, it was very participatory, kind of, you could engage or you didn't have to. Wellness programs are always voluntary, right? They can't be mandatory, but it was, employees engaging in their preventive care utilization. It was taking health assessments. It was attesting to tobacco use or not. And over time, we've enhanced that to be a little bit more outcomes-based. So now employees that are meeting metrics that are considered healthy or not at risk for things like their BMI, their glucose, their blood pressure, they're earning points throughout the year that allow them to not have to do as many activities, right? We kind of know that they're probably doing the right thing through physical activity and nutrition and maybe mental health support. So they're gaining their incentives a little bit faster. But we always have alternatives for our folks that maybe aren't there yet or they're working towards those behavior changes. So it's evolved over time, but that also includes other programs and resources that live a little bit outside of that. So we've recently partnered with a mental health provider that all of our employees, whether you're on our plan or off the plan, have access to free therapy. So you don't have to be involved with Higginbotham in any way other than being employed, and you get to access those therapists at no cost. Very similarly, we've got access to dietitians. You don't have to go find a dietitian. You can call the ones that we've already outlined for you. We know how much coverage you have. You can talk one-on-one with a dietitian. We've got resources for condition management. Do you have hypertension or diabetes? You've got free equipment waiting for you. You can talk to a pharmacist as much as you want. And behind the scenes, you're also being incentivized to do all that. So you're being incentivized either through premium differentials or gift cards or things that help you make that change a little bit less intrusive. So it's certainly grown, but we never want to be complacent, right? We want to make sure that those benefits and those solutions are the best benefits and solutions for our employees. But it is a nice story to tell when we're talking to our clients to say, listen, we're not just talking the talk, right? We're really walking the walk. And I think that that's a testament to our leadership to know that there is a bottom line, right? And we do have to be cognizant of that, but we also have to understand that the culture can make a huge impact on recruitment, retention, all of those things. And we've been very lucky to have the investments of those senior leaders and all those benefits.
Yeah, I think it's so important and such a differentiator for us that we are practicing what we preach. We've been fortunate enough that we've seen a number of now partners come from competitors of ours that have told us that, hey, like we walk into meetings, we proclaim a certain gospel, and then we go home and we don't practice that. And that, I think at Higginbotham, we can have a lot of pride around, like we are literally opening the book together and saying, okay, like where do we go here? What is the best thing to do? And then implementing the very things that we're advising our clients to do, which I think is really cool. And it, similar to you, one of the things that we loved about you when we interviewed you is like, we believe everyone at Higginbotham should be like a player coach and should be someone that is practicing the things that we are purporting. That's why Rusty Reed is our largest producer, is that he is an insurance practitioner, and so we think that that's just like the way that we should do things. So you talked about it in your intro. You are a practicing physician. What do you think? What value do you think is driven by the fact that you are still practicing today while you do this? And to be clear, this is his day job, but he's Batman at night as Dr. Ritter as well.
Yes. Boy, and practicing has been and always will be deeply meaningful to me, but also simultaneously deeply overwhelming. But I mean that in the most positive way possible. It's just, taking care of folks in this system can be pretty challenging. But I think what that brings to the table is echoing off of what you just mentioned about yourself, about Higginbotham in general being its own case study as we go and present ourselves to potential prospects. And I feel that I fit the same mold, same thing that you said about Rusty. And so I think, continuing the practice helps on multiple different fronts. And that is, one, emotionally, and in terms of the impact that I have on people, it provides me a lot of identity and positive impact in taking care of patients. In addition to that, it helps me understand what's happening at the point of service. Like what kinds of issues are patients encountering in order to be able to get access to care, especially in the emergency department, which is kind of like the last safety net where things have fallen apart and you're there trying to piece it back together. It's a bit self-defeating, but wouldn't it be great if no one needed the emergency department? And so you learn a little bit about what's driving behavior and incentives that people seek care there. And I think there's an element of being able to communicate the story of why we are trying to help people by living that story. So, when we are moving forward with our mission to help equip clients with the tools that they need to be able to take the best care of their members, I think that there's value in understanding how physicians behave, patients behave, and the deeper foundations of that interaction and how that's being impacted by changes within the healthcare system writ large.
I'm going to ask you a follow-up to that just kind of came to me while you were talking. Is like, what about the inverse of that? Are there ways that your day-to-day patient care, at least the lens at all, has been impacted by the seats that you've worn, at McKinsey and then in your chief medical officer role and then now at Higginbotham? How has that kind of shaped the way that you think about patient care?
I think anytime that you understand a system better, it increases your empathy. I think it's easy to get burnt out either as a provider or a patient, feeling that you lack futility or things aren't transparent or it just feels overwhelming. As you dig into it and learn more about it, I think it helps you build empathy. And then I think that empathy helps you connect with clients and understand what their pain points are so that you can help solve them. And I think that's carried over in being able to take care of patients, understanding what barriers there were that led them there. So, for instance, not to paint too many details, but imagine somebody came into the emergency department and they passed out. And in your mind, you're thinking, well, how in the world did this happen? Having the perspective that we have here, there was a particular case I remember that person couldn't afford their anticoagulant medication, and so they ended up having a stroke. And what were the circumstances were in place that they couldn't afford it, and it had to do with the way that their employer-sponsored plan was designed, and there were barriers in them being able to get their medication. So it helped me understand what was driving folks to the emergency department. So in the back end, the patient ended up being okay, but on the back end, it helped me understand what I might be able to do, recommend, steer them towards so that it didn't happen again.
Yeah, it's awesome. It's powerful stuff, and it's awesome to have someone with that perspective on the team. Katie, he talked a little bit about lack of transparency in the system. There's also a kind of lack of incentivization sometimes when, depending on funding arrangement and what the process looks like in certain instances for the system to work in favor of the end user. So speak to maybe from your experience and just be blunt with like, how much can we do when we have like a fully insured client? How much can we do when like it's self-funded and it's a large group versus captive and, you know, all that kind of stuff. Maybe let's just be honest about like, where can we really dig in? If I'm an employer, how should I really be thinking about this if you and I were just hanging out talking like we are?
Yeah. I mean, I think what we can do is almost at the mercy of the client's appetite as opposed to their plan design sometimes, right? They have to be willing to engage and invest in programming or initiatives or strategies. We're trying to flip the script with them a little bit to say, like, let's not be penny wise and pound foolish, right? We want you to really invest on the front end of this so that your hard-earned dollars are not going to pay for these chronic conditions that were entirely preventable. Now, when we're talking to a fully insured group, the data that we receive is pretty generic, right? We might get a little bit of information on their top claimants. We can't assume that that's indicative of what's happening across their entire population. We might get a little bit of information on the top 5 categories of spend, right? It might very likely will be MSK, probably diabetic medications more often than anything. We're seeing, cardiac events. So we get the same information from a fully insured carrier all the time, right? We can put some pretty blanket, generic programs in place to address that, which to me is better than nothing, right? If you're not doing anything and you're receiving bad renewals every year, it's not sustainable. If you think population health doesn't work, then just, maintain your unsustainable renewals and talk to me in a couple of years. But when you're self-funded, or if the trajectory is to be self-funded, that's even more important, right? We need to keep your healthy population healthy. We need to manage the population that might be experiencing chronic conditions to the best of our ability. And then we need that clinical integration from Sam's team to dive into those more complex cases that might be better managed by steerage or access or something like that. So when we're self-funded and we do have access to more data, that can help us narrow even further. So an example we like to give is, we might see mental health as one of your top conditions, but on a fully insured carrier report, we don't know anything about what that mental health condition is for one individual or across the board.
Right.
So are we talking about a large population of adolescents with ADHD, or are we talking about a large group of employees with depression and anxiety, right? Those are 2 totally different trajectories on how we would strategize or how we would integrate Andrea, our mental health consultant, to tackle it. But we don't know that if we don't have the more finite data from a data analytics platform.
Yeah, it's really good. And you, again, thanks for leading this for me. But, she talks a little bit about kind of the clinical hand-to-hand combat aspect of what you do. What does that look like for our clients? If I'm fortunate enough as an employer, or if Higginbotham's fortunate enough that an employer chooses to work with us, what does it mean when you get engaged on a claims basis, or what's an example of ways that that's been supportive?
To piggyback off of some of the things that Katie said, I think that there's a couple big buckets. I think one of the buckets is what can you do across a group? And to build off of what Katie says, the information that you get from a fully funded client may not have the granularity for you to be able to discern where those interventions will drive the most impact. You get some information, but it is quite hard to really implement a solution that will work. And I think that's one of the blessings, the upsides of taking on a level funded or self-funded scenario, is that now you have access to all your claims. And as we build our capabilities within Higginbotham, we'll be able to feed that into a data analytics system and really dive deep into the macro view of health across our book of business or a region or a specific client, and a micro view, which might be really high cost, complex claims. And what we've done so far is take data and understand, whole populations. Maybe a particular group has more GLP prescriptions than you would imagine. So what kind of solutions could you implement? And sort of tangential, one of the biggest things that Katie's team does that's hugely beneficial is that every dollar invested in preventive care, and this is well-reviewed, well-published, but every dollar you invest in preventive care is substantially more impactful than what you can do at the end stages of care.
Mm-hmm.
So if you can figure out how to keep people healthy so they don't need as many healthcare resources, that's going to go immediately to your bottom line, which is good financially, but it's also good for the patient. To bring us back from that tangent, the other part of this is, and I think I play a large role in this area, is the micro view of taking care of these complex, high-cost claims. And there's a number of success stories that we've had with clients, but digging into those individually and understanding, all right, this member had $1 million worth of claims over that year. What were the conditions that created that? Where were they getting their care? Are there opportunities where maybe they were getting a particular kind of care at a setting that was twice as expensive as it would have been if you could figure out a way to do it at home? And there's lots of examples where that's the case. And getting a pair of eyes on that and really digging in helps troubleshoot solutions so that you can make the care more patient-centered. Oftentimes, folks are happier getting care in more, familiar settings that are cheaper, like at home. And on the other end, it helps make it more affordable.
Yep. Yeah, I mean, we kind of touched on so many things there. I think, it's a really cool time to me to be in employee benefits, because more than any other time in my short career so far is you're seeing a significant amount of disruption, both with there's parity on the carrier side. We see more carriers than we've seen in any recent history. We have a lot of migration of our block of business, especially towards alternate funding, self-funded, level funded. You hear carriers, you insert the name, they're talking all the time about their blocks of business moving more and more level funded or ASO arrangements. And so I think that increase in transparency then puts a lot of onus back on, like, who's my broker then? Who is going to be the one that really quarterbacks this care? Because for most of our employers that we work with, they don't have a team that's going to do that. Obviously, our large groups, they may have a team that's very supportive and works hand in hand with yours. But for the most part, they're going to be looking back at a broker to say, what expertise do you have and can you support us there? And so kind of in light of those things, maybe kind of towards the end here of our conversation, I would love to hear from both of you. Katie, you first, around what do you think that future is in your space in particular? Like, where do you see the trends moving? Obviously, there's AI and LLMs and, there's all this stuff that's happening, new point solutions every day that I know your team is constantly vetting. I mean, from your seat, what do you see as the future of Pop Health?
Yeah, I think we just started living that future in January, right? I think for a long time we were missing the clinical leg to what we were doing here at Higginbotham. We've got very educated and very highly credentialed folks on the Pop Health team, but having somebody that can take a look at all of this with a clinical perspective has been really valuable, not just from kind of what we were strategizing on or what we're implementing with our clients, but from that third-party point solution perspective as well. So moving towards more data-focused strategies. We've always been proponents of evidence-based strategies, but it's really hard to find the evidence when you don't have your own story to tell, right? We've been at the mercy of the evidence of those carriers or those point solutions for a long time. Now with the migration to data analytics, we're able to make that differentiator ourselves, right? We're able to write those case studies and white papers and know what's working for our clients and what's not working. I think there's a lot of nuance in that, and making sure that our clients know you've got to have the senior leadership buy-in, you've got to have consistent and constant communication to your employees. It's very likely that you need incentives, but all of that combined, we can kind of see now what's working and what's not working. Your point to point solutions, we are constantly inundated by people saying we've got the best in GLP-1 management, we've got the best in diabetes management, we've got the best in dietary services. So we've got a a repository of all of these solutions. And what's been really nice with Dr. Ritter on the team is to just kind of hand those over, in chunks and say, hey, can you put a clinical eye on this and tell me, right or wrong, impact, no impact, or neutral, what's your thought here?
Right.
So that we can narrow that down when we're talking to our clients, because it's not helpful for us to go to them and say, there's 14 MSK providers out there in the market. Which one do you want, right? We need to narrow that down. We still need to make sure that it's the best fit for them, which I think could be a variation of a handful of solutions. But we're there as third-party consultants, right? We want to make sure that anything that we're putting in place is only for the benefit of that employer, not for the benefit of us. So I think the trajectory is moving in the right direction now, not only having Dr. Ritter on the team, working with Jeff's team to make sure that we've got the best understanding of our self-funded clients, and then working still within all the different departments of Higginbotham. So working with communications to make sure if we're putting the strategy in place, employees have to know about it, right? If they don't know, it's pretty there's no value to this.
Right.
Working with Ross and the compliance team to make sure all those strategies that we're putting in place are within that regulatory environment, everything's sound, and we're not putting anybody in legal jeopardy, right, by encouraging wellness behaviors.
Right.
So I think over time that will kind of evolve by default, and we'll get a little bit more of a story to tell with the data that's going into the system. But I also too always like using Higginbotham as kind of our original case study. We've got a little bit of flexibility in what we do here. We don't have as much red tape because we've got that senior leadership buy-in. So seeing what works internally gives us a little bit more of a trajectory on maybe what could work externally too.
Yep. Love that. What about you? What do you think?
You bring up AI and large language models, and I think every industry, every business, every new innovation leverages this and is looking to leverage this. And I think as we look at what we do moving into the future, the winners are going to be the people that can understand how to implement it and then use the output in a reasonable way. And a lot of AI and LLMs are only as good as the input. And I think what's going to be really unique regarding what we have the capacity to do is having all of this data across multiple different geographies and multiple different industries, so that we can create our own benchmarks and our own experience and have that inform whatever decisions we make or models that we build off of it. Will be completely unique and also less, what's the right word? More trustworthy in a sense, because we don't have any ulterior motive other than to help clients use that data in thoughtful ways. And so I think we'll be a unique place to be able to use those resources, that data lake, as you will, to drive positive outcomes. So whether it's, all right, we're working with X, Y, and Z point solutions or vendors, are they having the impact that we want them to have? Well, now we have our own independent repository of information to be able to sense check that and make sure that people are moving in the right direction. We'd be able to build more case studies as time moves on about how we've been able to implement solutions or engender better compliance and how that impacts things downstream. And you talk about people buying in and changing their behavior. Well, once you get a few of those stories, I think that they snowball and convince people to move along with you. So I envision that kind of being how this works in the future, is telling our story, making recommendations based off of unique, trustworthy information, and then having that inform decisions in a way that has scalability across our client base.
I love that. Yeah, I mean, I think I obviously see both of what y'all are talking about, and I think it's very well said. Maybe kind of our last final thing, and I'll tell you a little bit of maybe what my thing would be, is I'm going to ask both of you, if there was a client sitting here at the table with us or a prospective client, what is like the one thing that you wish you could say bluntly to some of the groups that we work with, but sometimes we have to manage expectation and read the room and all those things, which I think I would say is that oftentimes I remember, I've met with so many different clients that some of them, and I alluded to this at the beginning, some of them see benefits as, hey, we just want broadest network. We're willing to just deal with whatever the increase is every year, but we're not going to disrupt. We're not going to ask for greater engagement, and it is what it is. Like, if that's who you are, then okay, embrace that. Don't expect to see change. Understand that you will get an increase every year, probably be a double-digit increase based on the market that we're in today, and you're effectively going to roll the dice every year. And we can do all the work that we can to be the greatest service provider, but that's what exists. On the other end of the spectrum, if you're willing to be the employer that wants to disrupt, that wants to engage, and when I say disrupt, I don't necessarily mean like ruin your employees' lives. I mean, do things differently, engage in healthcare, talk about point solutions, make the investment. I think if that's what you want to do, then we absolutely have the mousetrap to do that. And just know that, like, we do believe you're going to see long-term outcomes there that will be better than scenario A. But those are just two different cultural approaches, and both are fine, Mr. or Mrs. Employer. Like, you can do either one you choose to do, especially in the country that we live in where we have great healthcare. But I think employers often should be honest with themselves about which one of those they are and which path they're wanting to choose, or if they're in the middle of that or whatever. Because often in our broker's seat, our job is to work for them. And if they can define the rules of the game, then we can meet them there, and we can be really good and a great partner. So maybe that's kind of my soapbox for each of you. What might you say?
Yeah, I mean, I would say we're using a lot of analogies today.
Yep.
I would take it as the analogy from a personal perspective too, right? If you're not really willing to disrupt your own personal lifestyle, to engage in proper nutrition, to engage in physical activity, to go get your teeth cleaned every 6 months, if you're not willing to do those things, in the long term, you're probably not going to have the best outcomes for yourself, right? I think that translates on a population level to say, if you're not willing to have your employees do those activities, the outcome long term is probably not going to be as good as it could have been had you been disruptive and had them doing those things. Now, I think that there's a lot of nuance to that, and we've talked about nuance a lot today too. But if you're okay with status quo, if you are okay with those higher renewals every year, to your point, okay, that's
Right.
great. We're not going to shove this down your throat, right?
Right.
We know it's not going to work if that's the case. But I do think there's something to be said for your employees are spending potentially a third of their day at the workplace. Even if they're remote, they're spending a third of the day involved in the company, right? You've got a lot of power with what happens to that third of their day. And over time, that can extrapolate quite heavily. So if you can put strategies, initiatives in place that impact the environment that they're in, so make the healthy choice the default choice, make the culture as healthy as possible, I think the trajectory is going to benefit you. And you've shown, maybe that there's an importance in the asset, right? The employees are the biggest assets. I think Rusty says that all the time, right? We're the ones going up and down the elevators. That's the biggest asset. So if you think about how much power you have as an employer to impact that individual's, 33% of their lifetime potentially, you've got a lot of room for creativity. You've got a lot of room for positive disruption that will bring you returns in the long run.
That's awesome.
It's probably even greater than 33% because the other 33% you're in bed. Does that count?
Yeah.
I don't know.
Half
Anyway,
of your awake time. Yeah.
I would say, a little sarcastically, do you even care?
Yeah.
And what I mean by that is, so I saw a tweet by Mark Cuban, or he retweeted, and there was some, unfortunate soul that was commenting, hey, what CEOs are actually managing their medical benefits? Because, what CEO has time for that? It was basically saying that's
Right.
beneath your
Right.
role.
Right.
You should push that off to somebody else. And Mark retags it and was like, you're an idiot. And made the case that, the cost of this is going way up.
Right.
But there's an opportunity where you can actually affect this process, and it's a double win. Your employees can be healthier and have higher retention rates and you can save money. So the best companies are going to be the ones that do care, that are bought in and want to take an active role in managing their employee benefits. So I say, do you even care? And if the answer is, I think so, then the next question is, what are the barriers to being able to get it so that you manage this better? And then the answer is obviously to partner with Higginbotham to be able to do that. And I think it becomes clear that if you do care, then why would you not choose a company like Higginbotham that's got the bench to be able to help you understand what you need to do?
Man, we were fortunate enough to have Nick Saban at our Hig Leader Conference last week, and he talked about the difference between a transactional leader and a transformational leader. He said a transactional leader just cares about, like, what can you do for me? Great, like, then you'll get this in return. And transformational leadership involves investment in the person. He actually used the weight loss analogy kind of like you did of, if a player comes to me and says, I want to be in the NFL, he says, are you willing to do the things that it takes to get there? Because if you are, I'll help you all the way. And I'll help you do all the things that it takes. But it's going to take more than just working out. It's going to take you eating right. It's going to take you sleeping. It's going to take you listening to your coaches. Like, there's a lot that's involved in that. So we talked a little bit about, Higginbotham and the success that we've had here and the program that you've built and what that looks like. Maybe if both of y'all could give some examples of other examples, client and patient name excluded, where we've seen our teams drive success.
Yeah. So the one that comes to mind is actually a group here in DFW. They're about a 400 life employer. They started their Pop Health program over a decade ago. It was pretty early intervention for them. They focused first on participatory activities, right? They wanted to push their employees towards preventive utilization, all of the benefits that they could take advantage of. They were giving credit for other healthy behaviors. They were really removing a lot of barriers to those employees. So that could have been a cost barrier or a convenience barrier, right? They were bringing things on site to make it easier for employees to access. They were making the healthy choice the default choice in all of their locations. And over about a 10-year span, we saw all of their catastrophic claims literally move from chronic to acute, which was really valuable when they're talking to the carrier to say, we don't have these ongoing, reoccurring chronic conditions anymore. We don't have the end-stage renal diseases. We don't have these strokes and the cancers and the heart attacks that are impacting our claims. In fact, one year it was 2 catastrophic claims, and they were both completely related to an accident. So their medical director of the carrier that they were using actually stepped in and was like, what are you guys doing? Like, they wanted to use that client as a case study for the carrier programming because it had trended so well. And I won't say that that's 100% due to everything,
Sure.
Pop Health related, but I don't think it's a coincidence either.
Right.
So that was a really great case study that we've had over the years.
Yeah, that's cool.
I can think of 3 to mention. A couple that have to do with, vendor partners where we find an opportunity, and one that paints a picture of the kind of insight that we're able to drive with our internal bench of expertise. But one is Higginbotham, which we use. I think one of the biggest buckets of driving impact is through care navigation. And so we use a solution called HealthJoy, and they just released our 2025 information showing, how much money was saved through users engaging HealthJoy members, us, to be directed to sites of care that make sense for their condition. And, that number was 7 figures in terms of avoided urgent care utilization, emergency department utilization, better priced specialists, imaging centers. So, being able to embed these solutions and understand the kinds of companies that would benefit from these solutions, places that maybe have overutilization of emergency departments or urgent care or higher cost settings, that, we have partners that do a really good job helping solve those issues. So that's one example. Another example is it seems like when reviewing a lot of the highest cost claimants, there's a lot of spend in the cancer and rare diseases department. And it has a lot to do with chemotherapy, immunotherapy. Those infusions in the hospital setting are very expensive. And so we've have another partner that actually helps, in a HIPAA-compliant, patient-centered way, do reach out to members and investigate, hey, are you interested in being part of a clinical trial or a new study related to either your rare condition or cancer? And oftentimes when you get those folks plugged into those studies, their care is more seamless. They're part of a very well-run clinical trial, but their cost goes down because part of the clinical trial, the manufacturer, whoever's sponsoring it, is paying for some of the therapy. So there's been some circumstances where we've been able to, we worked with one such client where we were able to get their highest cost claimant plugged into a clinical trial, and they were facing something like an 18% increase in their premiums on their stop loss, along with an increase in their deductible, and they were going to laser this person, and they got them enrolled in the trial, and all that went away. And then the last example I would give is just kind of the work that we do in reviewing these cases. We're doing a deeper dive. There was another stop loss circumstance where a person was going to be lasered. It was going to sort of float the price for the whole company because of really expensive cancer care. When it's a little, there's always a little bit of, an introduction to the facts of life that not everybody has a good outcome. And in this particular instance, they had a lot of spend, but the outcome wasn't going in the direction that anyone would want. This person was entering the end stages of life, but that was really hard to understand just based on a diagnosis and how much is being spent on it. But if you do a full claims analysis, you saw that there was an increasing amount of billing for hospice care, and all of the expensive chemotherapy care was going away. But being able to communicate that to a stop loss company, that could easily be overlooked, and then all of a sudden your premiums go up. But we were able to dig in there, communicate that to the stop loss carrier, and help avoid unnecessary expenses.
And I think one of the emphasis I'll give to both of those case studies is that both of those scenarios require an engaged agency. The stop loss carrier is not going to do that level of detail in most cases. The HR team doesn't have the time and bandwidth and expertise to know what point solutions and how do we engage here and how do we incent population. But it takes us as an agency partner proactively reaching out, evaluating claims, making the case, advocating on their behalf. And when we do, we can be really good. And so, I kind of put a bow on this to say, first of all, thank you. Both of you are transformational leaders. You do a great job with your respective teams, with our clients. We are blessed and fortunate to have y'all's talent on the team. Yours for a long time and yours for a little time. And you and I have gotten to kind of grow our careers together, which has been a lot of fun. But I think this has been an awesome conversation. The depth and breadth of knowledge that y'all bring to Higginbotham is so helpful to our clients and our people. And I think, as you said it best, if you do care, then why wouldn't you work with Higginbotham? Well
or
said.
At Higginbotham, if you want.
Yeah, both.
We have great benefits here.
That's right. Either come work with us or for us, or either way, we'd love to see you.